Hello, all you freedom-loving people. The Trump administration is working to bring down the cost of medication and to remove illegal immigrants from Social Security. And who is to blame for the war besides Putin? Okay, let's get into it. President Trump signed an executive order on Tuesday directing measures to prevent illegal immigrants, fraudsters, and other ineligible people from obtaining Social Security. White House Press Secretary Caroline Leavitt said during the daily press briefing it will expand the Social Security Administration's fraud prosecutor program to at least 50 U.S. attorney offices, and it establishes a Medicare and Medicaid fraud prosecution program in 15 U.S. attorney offices. The memorandum was supposedly in response to DOGE's recent discovery of fraud by Social Security recipients. Social Security Administration data show that Social Security recipients range from well over 100 years old to less than 5 years old. Leavitt said these taxpayer-funded benefits should be only for eligible taxpayers. The White House announced that more than 6,300 illegal immigrants were stripped of their Social Security and other federal benefits. Those individual Social Security numbers were reclassified by the SSA into an ineligible master file to further ensure that they can never access federal aid again. These 6,300 illegal aliens who have been stripped of their Social Security and other federal benefits were granted humanitarian parole to enter the U.S. since 2023, and many of them are listed as terrorists by the FBI or have criminal records. Even so, they have not only applied for Social Security, but also have been approved for a number of other government benefits, including Medicaid, according to a DOGE release. In order to cover the Medi-Cal costs for hundreds of thousands of illegal immigrants, California Governor Gavin Newsom just signed a bill that urgently allocates $2.8 billion to fill California's Medi-Cal funding gap. California has expanded its benefit coverage population since January of 2024, extending the full Medi-Cal benefit, which covers all essential health services such as outpatient, inpatient, emergency, prescription drugs, dental, mental health, vision, and long-term care to all income-eligible adults regardless of immigration status. This policy is praised by the left but heavily criticized by conservatives. This policy makes California the first state in the nation to provide free, comprehensive health care to all low-income adults, including illegal immigrants. According to state data, roughly 1.6 million illegal immigrants are currently enrolled in Medi-Cal, which is a big part of the program's total 15 million enrollees. Republican State Assemblyman Carl DeMaio has called for an audit of Medi-Cal spending, saying that California can't afford to provide free health care to illegal immigrants. He wrote on X, "We must stop new enrollments of illegal immigrants and rein in this unsustainable program before it collapses entirely." The Newsom administration denied that welfare benefits for illegal immigrants were the only reason for the white card's fiscal shortfall, pointing to rising drug costs and increased access to health care for the elderly as contributing factors. Before we move on, I want to thank all of our viewers for your support. Your support has really helped us to get to where we are today. We know our content deserves to be spread all around the world, so in order to break through, we asked you yesterday to leave a comment below the video. Many of you left American flag emojis or left us very encouraging messages, and I want to thank you for doing that. It was very heartwarming, and this helped to boost the engagement rate, and we saw the positive results already. So I'd like to kindly ask you to please leave a comment again today and to keep doing so as often as you can. With your continued support, we're confident that we will be with all of you freedom-loving people long into the future because everybody deserves to know the truth. Okay, let's get back into it. Republican legislators and fiscal watchdog groups warn that Medi-Cal spending will be unsustainable without major reforms. Medicaid is a fast-growing entitlement that now spends more than $850 billion a year while delivering subpar health care for the poor. In an April 14th editorial, the Wall Street Journal noted that Medi-Cal needs to be reformed and that there is a moral case for reform. Because on average, more than 6 out of 10 healthy adults among Medicaid enrollees do do not have employment income, which means they do not work. The Medicaid program, which serves low-income communities, now costs more than $850 billion a year. The Wall Street Journal pointed out that under the threat of the leftist camp and the media, the Republican Party is afraid to deal with the failure of the Medicaid program, and even President Trump is already having doubts, but the Republican Party can still win the Medicaid reform debate and make their case in the moral terms that it deserves. The Wall Street Journal also wrote, "Voters tend to think of Medicaid as a safety net for low-income pregnant women and disabled Americans. But Barack Obama's Affordable Care Act expanded the program into a permanent entitlement for childless men in prime working age. Administrative records from state Medicaid agencies in 23 states show that millions are declining to work at all, which is damaging to the country economically and culturally. Democrats describe the requirement for those on Medicaid to work as bringing Americans back to indentured servitude. But the Republican 2023 proposal of the Medicaid work requirement is fairly modest. It asks for 20 hours a week, which could include training for a job or volunteering in a local library, for example. And Republicans are making exceptions for almost anyone with a valid reason. Those who are pregnant, have children, or are caring for an incapacitated relative are exempt. Those who have a doctor's note saying that they are unfit for work are exempt. The same applies to people who are in school or receiving help for alcohol or drug abuse. The Wall Street Journal's editorial board believes that when Republicans passed a budget outline in the House of Representatives last week, it was a once-in-a-generation moment for government reform. In a recent Kaiser Family Foundation poll, about 62% of voters supported Medicaid work requirements. That includes 47% of Democrats, 60% of independents, and 82% of Republicans. The Wall Street Journal editors also wrote, "Work as a condition for benefits is an American economic and cultural norm. If more healthy men get back into the workforce and ultimately off Medicaid, the program will be able to focus on the poor for whom it was originally intended." House Speaker Mike Johnson is adamant on this issue. He told a reporter recently that Medicaid isn't for 29-year-old males sitting on their couches playing video games, and we're going to find those guys and we're going to send them back to work. Meanwhile, the Trump administration is working to lower drug prices and to make healthcare more affordable. President Trump signed an executive order on Tuesday to expand drug imports, to improve the drug price negotiation system, to adjust insurance coverage rules, and to conduct a comprehensive review of the operation of the current drug pricing mechanism. The United States is one of the most expensive countries in the world for prescription drugs. According to an HHS Commission study by Rand Healthcare in 2022, the U.S. spent about 3.2 times as much on brand-name drugs as other developed countries. Even with health insurance, many people still have to pay significant costs for medications on their own. The executive order directs that the FDA streamline the importation process so that states can import drugs directly from lower-priced countries while ensuring safety and quality. The executive order also requires the Secretary of Health to propose within 60 days implementation guidelines to increase the transparency of Medicare drug price negotiations and to prioritize those drugs with higher Medicare spending burdens. The executive order also proposes several key measures targeting groups with greater pressure on drug prices. This part of the order focuses on Medicare. For example, it would require a survey of the actual costs of drugs purchased in hospital outpatient clinics and adjustments to Medicare payment standards as necessary to ensure consistency with market prices. It also requires the Department of Health to design and pilot new payment models within 1 year to improve Medicare's ability to negotiate for high-priced drugs and biologics, and it also calls for optimizing the Medicaid drug payment and rebate system. After the first round of talks between Russia and Ukraine failed with the U.S. and the Middle East, both Russia and Ukraine stepped up their attacks. The latest attacks took place on Sunday. 2 Russian ballistic missiles struck the center of the northeastern Ukrainian city of Sumy, killing at least 34 people and injuring 117 others. It was one of the deadliest attacks of the year so far. An interview was aired with Zelensky on Sunday. In the interview, Zelensky said that he hoped the U.S. would sell Ukraine the Patriot air defense system. Zelensky said, "I told President Trump very clearly what we can do." Zelensky said Ukraine is ready to purchase 10 Patriot systems. He said, "There is the Patriot system, and you have many of them. You also have production capacity. There are a few steps to protect Ukraine. Step number one system costs $1.5 billion. We are ready to buy it." So, on Monday, reporters raised the issue of Ukraine at the White House. President Trump rejected Zelensky's request. President Trump said, "You don't start a war against someone 20 times your size and then hope that people give you some missiles." President Trump also blames his predecessor, Joe Biden, for the war's casualties. President Trump told reporters millions of people died because of 3 people. Let's say Putin, number 1. Let's say Biden, who had no idea what the hell he was doing, number 2. And Zelensky. President Trump's views on the Russia-Ukraine war have been criticized by the establishment media, but even the left agrees with President Trump on this issue. Alan J. Cooperman is a professor at the University of Texas in Austin, where he teaches courses on military strategy and conflict management. He wrote a piece not long ago titled, "Sadly, Trump is Right on Ukraine." The article starts off with the author saying, "I rarely agree with President Trump, but his latest controversial statements about Ukraine are mostly true. They seem preposterous only because Western audiences have been fed a steady diet of disinformation about Ukraine for more than a decade." He then goes on to illustrate in 3 key points why Ukrainians, as well as former President Joe Biden and Vladimir Putin, bear a great deal of responsibility for the outbreak and continuation of the war in Ukraine. The first key point that he pointed out is that the cause of the Russian occupation of Crimea in 2014 was due to the violence initiated by right-wing militants in Ukraine. This is affirmed even by a Kyiv court. Ukraine's president at the time was the pro-Russian Viktor Yanukovych, who in 2013 decided to pursue economic cooperation with Russia rather than with Europe as originally planned. Pro-Western activists protested peacefully, occupying Maidan Square and government offices in the capital. By mid-February 2014, the president finally made significant concessions, after which the protesters mostly withdrew from the square. His article says, "Just then, however, right-wing militants overlooking the square started shooting Ukrainian police and remaining protesters. Police returned fire at the militants, who then claimed bogusly that the police had killed the unarmed protesters. Outraged by this ostensible government massacre, Ukrainians descended on the capital and ousted the president, who fled to Russia for protection." Southeastern Ukraine is home to a large number of ethnic Russians. They believe that their president was overthrown undemocratically. Putin deployed troops to Crimea on behalf of these ethnic Russians. While this backstory does not justify Russia's invasion, it explains that it was hardly unprovoked. The second key point is that Zelensky violated the peace agreement with Russia. Zelensky's predecessor, Petro Poroshenko, negotiated the Minsk Agreements 1 and 2 with Russia in 2014 and 2015. The agreements stipulate that Ukraine should guarantee limited political autonomy for Donbass by the end of 2015. Putin hoped that this would prevent Ukraine from joining NATO or becoming a NATO military base. But Ukraine refused to honor that promise for 7 years. Zelensky ran in 2019 on a promise to finally implement the Minsk agreement to prevent further war. After winning the election, however, Zelensky reneged on his promise. Instead, he increased arms imports from NATO. This exacerbated tensions between Ukraine and Russia. And that brings us to the third key point. President Biden's incitement to Ukraine at the end of 2021 when Putin mobilized forces on Ukraine's border and demanded implementation of the Minsk deals. If President Biden had insisted that Zelensky comply with Putin's demands, then the situation would have eased. This is because Ukraine is dependent on U.S. military aid. The article says, instead, Biden lamentably left the decision to Zelensky and pledged that if Russia invaded, the U.S. would respond swiftly and decisively, which Zelensky read as a green light to defy Putin. Cooperman also agrees that if President Trump had been president at the time, he likely wouldn't have given Zelensky such a blank check to start the war. He laid out the basic framework of the agreement to end the fighting as obvious. Russia would continue to occupy Crimea and other parts of the southeast, while Ukraine will not join NATO, but will receive security guarantees from some Western countries. He believes that any agreement negotiated now would not be as good for Ukraine as the Minsk agreements. He concluded by saying, even more tragic, whatever peace deal emerges after the war will be worse for Ukraine than the Minsk Accords that Zelensky foolishly abandoned due to his political ambitions and naive expectation of bottomless U.S. support. And that's a wrap for this episode. Thank you so much for your support of Front Page. Please remember that every like, comment, and share helps more people to see the truth. If you haven't already, please subscribe. And if you have already subscribed, we thank you, but please double check to make sure that you're still subscribed, because some of our audience have reported that they're somehow unsubscribed without their knowledge. We've also heard that many of you don't get notifications of our videos anymore on YouTube. So when you do subscribe on YouTube, please make sure to tap the notification bell as well. Okay, this is our show for today. Thank you so much for tuning in. If you like what you heard today, please don't forget to like this video and share it with your friends and family, because everybody deserves to know the truth.